So our next guest was ABC Limpopo, responsible for the education, agriculture, environment and the transport department. He was previously the Minister of Health from 2009 to 2019. For most of the past decade, Dr. Motsoaledi was tasked with ensuring that people in South Africa have access to quality healthcare services. Towards the end of last month, the Motsoaledi era came to an end with the appointment of Dr. Zweli Mkhize, South Africa's new Minister of Health, and Dr. Motsoaledi was appointed to the Home Affairs Department. Minister Motsoaledi joins us now to talk about his new role, but obviously we cannot ignore the 10 years that he spent at the Department of Health. Good afternoon to you, Minister.
Good afternoon, Palisa, and good afternoon to the viewers out there.
Now, as I said on my introduction, that you've been with the Department of Health for about 10 years. You're a doctor by profession. I've heard you on my many show, from my days in radio to all the other shows that I've conducted here on the SABC News. And the passion has always been there in the health department. How are you finding this new department?
Well, I always try my best to have passion for whatever I do. As you said during introduction, I went through the Department of Education in Limpopo, Department of Transport, Department of Agriculture, where I remember some people were saying within 6 months I will have run away because I understand nothing about agriculture. But I managed. I remember even getting a prize from some farmers' organization about the work one was doing. So I've always told myself, somebody said, if you are in the struggle for liberation, you must be like a prickle pear. Wherever you throw a prickle pear, it grows.
It does,
It grows wherever, and I've told myself that perhaps I must try to practice something like that. As to whether I'll be able to, I don't know. But I've already gone to a number of Home Affairs offices. I've already gone to the institutions that are governed by Home Affairs. I must tell you, I'm very excited.
You're excited, okay.
Yes.
We're going to come to that, but I just want us to reflect a little bit on your decade at the Department of Health. Of course, you've been lauded really for achieving victories when it comes to HIV and AIDS and the non-communicable diseases through supporting the health promotion levy, also known as the sugar drinks tax. When you look back at the 10 years at that particular department, what are the successes that you can point out and say, as much as I've moved from that department, but I'm proud that I was able to achieve 1, 2, 3.
Oh, you are putting me in a very difficult position. I thought you'll call Minister Mkhize to talk about the department.
We just want to hear about your successes, really.
Yeah, look, as you are aware, Palisa, around about 2009, when I came into the Department of Health, there was a big war between the department and HIV/AIDS activists. HIV/AIDS was ravaging. The death toll in the country, as you know, was very high, unimaginably high. Death toll from both HIV/AIDS and TB. Maternal mortality was very high because of HIV, because 50% of maternal mortality was driven by HIV. The number of children who were born HIV positive was, outstanding, amazing. So, but because we started putting up the biggest antiretroviral program in the country, if you remember, starting with the HTT campaign, which was launched in April 2010, that South Africans must test and go on ARVs. And at the present moment, you are aware that at that time, there were 923,000 people on ARVs. Now, we have got 4.5 million people, and the department is on course to add 2 more million people to put 6 million on ARVs. What are the results? The results was that, as you know, life expectancy rose in South Africa because it was very low, from something like 57 years to 64 years now, and still rising. Maternal mortality was halved, and as is child mortality rate. The number of people who were dying of HIV dropped dramatically. TB deaths also dropped because many people whose TB problem was driven by HIV started getting under control. So in other words, we have not yet arrived where we want to be as far as HIV/AIDS is concerned.
Yeah.
But we have got the pandemic more or less under control. No longer, I still remember people telling me that anybody who wants to start a new business will open up a funeral parlor, a funeral type of business, because You know, they were all
People were
over.
dying.
I got very happy and emotional when Jackie Skuman, a lady from Tafondane, who had a hospice for kids who were born HIV positive and many dying within 6 months, when she phoned and said she's closing the hospice because she can no longer get the children who are coming there to die. And I remember even taking her to Parliament to introduce her to members of Parliament, especially in the NCOP, to say this is the lady who could make it happen. But I remember also somebody telling me that he comes from Piet Retief and say all the funeral parlors there are closing one by one, whereas they used to, you know, bury people all the time. And you know, it makes you feel anecdotally that something is happening.
Something is happening. And here we are seated today talking about all things HIV and AIDS, and there's a conference currently taking place at the ICC in Durban. But let's come to your new department now, the Department of Home Affairs.
Ah, that's where I belong.
That's where you belong now.
I feel comfortable being asked questions there.
Yeah,
yes.
Your plans, Minister, with this department, as you said earlier, that you've spent some time really trying to visit some frontline officers, engaging with citizens, and also trying to understand perhaps the cause of the delays at some offices.
Yes, Palesa, maybe why shouldn't we start from the beginning? What is the core function of the Department of Home Affairs? Its core function is to provide citizens with identity. That's the main thing, the main reason why Home Affairs exists. People cannot just be born, get married and die without it being recorded anywhere. And that is the job of Home Affairs. And of course, because we are dealing with human beings, a lot of things do go wrong. A lot of delays do take place. And my going around was to study the system and see exactly where improvements could be. I think every minister who went through Home Affairs will do something like that. For instance, the people will complain about having to queue for a long time outside the Home Affairs office. Fortunately, I experienced the same thing in health. Because when I left there were issues about long queues in the Department of Health, but now we also have long queues in Home Affairs, and they've got a special project in the department. They've got a special program to try and deal with the long queues.
All right. So your observations generally from the centers that you were able to visit? We've spoken about the long queues. Yes,
my observation is that there are two types of offices for Home Affairs in the country. Firstly, there are 411 Home Affairs offices. That means outlet where you go when you want this documentation. But there are two types. There are offices which can only offer basic, what they call legacy services, which they abbreviate as BMD, birth, marriage, and death. So all offices can do that. But now Home Affairs have upgraded 193 of these 411 offices, which can offer people better services, more advanced services, which can issue the smart ID. I'm sure you are aware, part of the reason why we're having these long queues is that people used to have IDs, as you know. But now we've switched over from the green book to a smart ID. There are 38 million South Africans who need to be switched over to the smart ID, and only 15 million have been covered. We are still left with 25 million. I'm not counting those who are young, who are coming for the first time to take ID. I'm talking about people of my age who had to switch over. Now we need to switch over 38 million. We have completed 15 who are only able to do 3 million per annum, because only the 193 offices can do that. But so we are busy in the process of upgrading all the offices so that all 411 of them can do that. We have also having a PPP with the banks. I understand banks would like all their clients to have the smart ID, because that one cannot be, they cannot be fraud.
It's safer.
It's much safer. The banks like it. So up to so far, 12 branches of banks in Gauteng. You can actually apply online and be called to the bank to take biometrics and get all this new ID and a passport. You can do that. There's Unfortunately, there's only 12 in Gauteng only, and 1 in the Western Cape. The other provinces have got nothing. This year, we've got a program to add 29 more, and next year we'll add 70 more of these banks, so that sitting at home, you just go online, and then the bank call you, you take biometrics, and you can get your ID.
You collect.
Yes.
And the reality, Minister, is this department has recently been applauded by the public for its efficiency. I, for one, had applied for a passport, and 3 days later I received an SMS to say my passport was ready for collection. And that is generally what a lot of people have been saying. So I suppose the bar has been set quite high for you. You will have to maintain the status quo, even improve on what has already been created by your predecessors. So you've identified as well that there are too many systems which run different functions within the department on its own. Talk to us about that.
Yes, the reason that you get that about passport is because 90% of passports are issued within that period you've mentioned. Yes, within a period of a week or 2, we can issue the passport.
So that's how it's
I think it's
supposed to
5
be.
days.
Yeah.
Yes, that's how it's supposed to be. But we are still left with 10%. And as you say, I need to improve on that. And obviously, the improvement will occur. For instance, a passport you can apply in the banks also. As I said, if we increase more banks, many people who need passport do visit banks quite often, and they'll be able to get their passport there. But as I said, it's only 193 offices that can issue that. The remaining out of the 411 can only do the BMD, as I said, give you a birth certificate, a marriage certificate, or a death certificate, and the old ID. By the way, that's another conundrum. We're still issuing the old IDs, because even if we are switching on to new ones, if you stay in the outlying areas, you visit one of these offices where they can't give you the smart ID, they can't say wait until you come to smart ID, because your life will come to a standstill. Yeah. So we still issue them the old green book, ID booklets, with a view to try and swap them later again to the So it's quite a process that will take some bit of time.
I just want to move a bit fast, Minister. I see we're running out of time. Let's talk about the recent attacks on foreign nationals, the truck drivers most importantly. I know that you were part of that interministerial committee looking into this issue. And part of what many South Africans were saying is that the foreign nationals are taking their jobs. And I know that your department is actually responsible for providing the permits, if one can say, in this regard. Talk to us about that process.
Indeed, I was in Durban, as you know, with the Minister of Transport, Minister Mbalula, Minister Begicele, who had convened us, Minister of Police, and Minister from the Department of Labor and Employment. We were all there because we are all together responsible for that area. What I listened to the truck, because we met the truck owners and we also met the truck drivers. Yes, the truck drivers are complaining about what you say, that they are not being given jobs. And we said, if we have to follow all the laws of the country, we ought to be able to solve that problem. For instance, you do have skills that are scarce, scarce skills, which can only be performed by certain groups of people, maybe from outside the country. The Department of Home Affairs is the department that can provide a certificate or a license for that. If you say this skill is rare. What I've seen is that some employers don't even do that. They just hire anybody and then come and say it's a scarce skill. For instance, we were told by some of the truck owners that some of their trucks are highly specialized, and no South African can drive them. I'm not sure whether anybody can believe that, but fortunately we put together a task team from Home Affairs, from Transport, from Labor, from the police, from the truck drivers associations, from the truck owners, to sit together and work out the solution to this and tell us if indeed it is true that this truck, there's nobody within the length and breadth of South Africa who can drive it, then that company must still apply and say this is a scarce skill, and the Department of Higher Education releases a list of skills that are scarce in the country. And then using that list, we can actually issue permits and say you deserve a permit for this and that. It just simply cannot happen outside the law, but also we told the truck drivers that even if you think your employer is against the law, you have got no right to take the law into your own hand and go and ban a truck and all that, because
True.
you're also destroying the economy. You must come and say this employer is doing something wrong, and then we'll see how to correct it.
Now, Minister, one of the issues currently in the news now is Wits University Law Clinic announcing that it is planning on bringing a class action lawsuit against your Department of Home Affairs for what they call the department's failure to deal with fraudulent marriages. Your response to that?
Yeah, fortunately, I'm just from there now. I've been sitting with the Wits Law Clinic. We've discussed the way forward. Firstly, I won't stop them from taking whatever action they wish to take, but I also want to work with them to resolve some of the issues. Palisa, this is the problem, and I want people to understand the nature of the problem we're talking about. Every year, the Department of Home Affairs gets more or less 2,000 fake what we call fraudulent marriages, not fake, fraudulent marriages.
Every year, 2,000?
Yeah, on average.
On average.
Yeah, just from April the 1st until now, recently, there are 2,132 such fraudulent marriages. And they happen in 4 ways. The first group are marriage of convenience. In other words, they are not fraudulent. It's people getting married to each other, hoping they'll just annul the marriage later through Home Affairs. It usually happens this way. A foreign national wants to get citizenship quicker without following procedures.
Then he marries a South African
woman. You marry a South African woman.
They give them money.
And you give her money because she needs money, you need citizenship. And they believe thereafter you just go to Home Affairs and annul it. That's the first group. The second group are indeed fraudulent. That's what we call syndicates. These syndicates consist of people from Home Affairs, even some marriage officers. For instance, the department is giving certain religious leaders the right to marry, and we've discovered that sometimes fraudulent activities happen, even with officials of Home Affairs. That's the second one. The third one is so-called employment agencies, where people are looking for a job. You come and say, I'm an employment agent. They give me all your information, your ID number, your whatever, everything, CV and all that. And now they've got all the information about you. And they say, we're going to get a job for you. They use that information to marry you to somebody.
Without your knowledge.
Without your knowledge.
Yeah.
The last one, which is the main one that took me to vets, is a duplication of identities, where somebody and you, Palisa, are sharing the same ID number. When that person gets married, they believe it's you.
And whose fault is it? The department's fault, isn't it? Because they're the ones who issue identity numbers.
Well, it's fraud. In this case that we are dealing with vets, there's a lady who came in with all the information about another lady and posted her. In other words, stole her identity and say, I want a new ID, and then this is me. And of course, an eviction has to start. Where I went to vets, and that lady was there to apologize. We were busy giving her a smart ID because it took too long. I was saying where I'm blaming the department is that it took too long for such a problem to be solved. But it's not that it was done by them. It was done by a criminal. I mean, criminals are always there in society. So what Home Affairs is doing to try and make sure that this doesn't happen is that any person who must get into the national population register to do this has to do so with a password, so that we come and know that it's Palisa who issued this from Home Affairs. But many of them just say my ID was stolen, I was in hospital, and they used my password, etc. So now
you're only going to try to fight it internally?
No, we've started a new system. You cannot get in there, give somebody an ID or a marriage certificate unless your biometrics are recorded. So every Home Affairs official. Has that been implemented, Minister? Oh yes, it's on.
Is it on now?
It's on now. Oh. For instance, nobody can give you this smart ID. It might not be in all offices, I'm telling you, but it's on. Nobody can give you this smart ID until they get in there and you get recorded. So it's definitely on.
Minister, we've run out of time, but thank you so much for choosing the SABC to be the first media house that you speak to in your new portfolio. We appreciate it a lot.
Thank you.
Thank you so much.
SABC is home, maybe.
We'll invite
Being
you
a public
again.
broadcaster.
Yeah, we'd love to take a look at the white paper, how far we are, the LSP, the Zimbabwe special permits as well, but we'll make another day. Thank you so much for coming
Thank
through.
you. Thank you very much.
The newly appointed Home Affairs Minister, Dr. Motsoaledi, sharing his thoughts and his plans, of course, with his new department.